India today has a huge opportunity in its healthcare system, an opportunity that arises out of the multiple challenges that plague that sector. But on the flip side, the story has also been a case of missed opportunity. While there has been a sizable increase in healthcare outlays, it has still not translated into benefits for the poor, who still face the burden of expensive medical treatment, or worse, no treatment at all. Though efforts are being made to move closer to the rural patient, the endemic structural problems like the absence of adequate infrastructure in these remote areas still need to be addressed.
We believe that in India, if you want to transform the way the healthcare is delivered, you have to concentrate on the number. I'll give an example. India has to do 2.5 million heart surgeries a year. And we are currently doing, all the heart hospitals in the country put together, only about 90,000 heart surgeries. When are you going to reach that number? How many 200-bed hospitals you need to build to reach that number? So we have to really look at a different model. We have done, Kiran, together with the Biocon Foundation, Arogya Raksha Yojana. So similar programs are going to prove to the politicians that the best gift they can give it to the citizens of the country is a health insurance policy, which will allow them to access high-tech healthcare with dignity. This transformation is going to happen very fast, and politicians are going to understand the power of giving health insurance. When that happens, the floodgates are going to open. And I am convinced that India will become the first country in the world to dissociate healthcare from affluence. We will have a similar scenario like what we have with mobile phone. 10 years ago, none of us thought that a beggar can have a mobile phone. Today, everyone has a mobile phone. Similarly, everyone will have a health insurance sponsored by the government, and that will really change the way the healthcare is delivered.
The private sector has to then build the healthcare delivery system, where the private sector then has to play that role of providing that healthcare, but supported by the government in terms of assuring reimbursements. But again, we have to make sure that we don't make the same mistakes of the West.
Kiran, the strength what we have in our country, unlike in the Western country, we produce the largest number of nurses in the world. Outside USA, we have the largest number of US FDA approved drug manufacturing units. Soon we will have more drug manufacturing units in India than in US itself. So these are our strengths. Yeah. And if there is one country which can radically transform the way the healthcare is delivered, making it affordable, democratizing healthcare, is India. Its sheer size and the numbers.
So for India, the strength lies in its numbers. But to convert these strengths into a viable healthcare system that supports the demands of its people, it is essential to connect all the dots.
We brainstorm about all these wonderful ideas, but then most importantly, we do have to deliver on these ideas.
Yes.
And we have to implement them in a very optimal way, because otherwise they will all remain wonderful ad hoc ideas. Yes. And we will be doing things in bits and pieces. Exactly. And not really gaining the real mileage and the benefits of what this powerful ecosystem has to offer.
Yes. Kiran, after heart, cancer is going to be the biggest problem which is going to play havoc in the healthcare delivery of our country. And when cancer starts, it takes about 10 years from the seed is sown till it becomes a full-fledged cancer. You got 10 years of time where you can detect this problem. If these ASHA workers are taught how to detect cancer at an early stage, because in our country, nearly 40% of the cancers are head and neck cancers, which is obvious, which can see it. So there are many, many things what we can do with them, and these are a very, very important components of healthcare delivery in a country like ours, where distribution of healthcare specialists is very uneven.
And as you say, early diagnosis means that the whole cost of healthcare comes down.
Kiran, if you diagnose cancer at an early stage with a few thousand rupees, you can cure them. You diagnose cancer at an end stage, even after spending few $1 million, you can't save the life.
If we want to bring about a change and reinvent our healthcare system, we need to look at containing the disease at the root. Early diagnosis in healthcare can go a long way in cutting costs, and technology can be the biggest driver in shaping early healthcare delivery. Devi Shetty, pioneer in using telemedicine in treating patients in remote places underlines its importance.
Kiran, there are 5 countries in the world which has the capability to put the satellite on the space. And we are one of those countries. We have the privilege of having that knowledge. We get the satellite connection from Indian Space Research Organization. It's called ISRO, free of cost. We are now connected to over few hundred centers in India, and also now we are connected to 56 cities in Africa. In difficult terrains where there is no landline, satellite is the best and the most economic way of communication. Because for the satellite, Kiran, satellite is distance insensitive and it is one-time investment. Using the telemedicine, we have treated over 53,000 heart patients in the last 8 years. It is the largest experience in the world in using satellite for treating heart patients. This is going to radically transform the way the healthcare is delivered. It is a matter of time, Kiran. Every general practitioner in our country will have a small video conference equipment linked by a mobile phone. If he identifies a patient with the diabetes, he will ask the patient to wait for a minute. He will connect him to the best diabetologist in town and the consultation happens. If the GP sees someone with kidney failure, he will get the best nephrologist on the other end and they can talk. Why should a patient travel all the distance and come to the city?
But then again, that tells you the power of technology, because you need to have mobile electronic health records.
Yes,
right?
exactly.
I think that's also going to be a very important part of our health ecosystem.
Exactly.
So if we want a health system that's effective, optimal, cost-effective, affordable, I think we need to use technology in the best possible way, starting with that whole database that we are going to create using electronic health records, which can be accessible from anywhere, you know, and wherever the patient is.
Yes.
So the mobility of the patient, and yet we need to ensure privacy of the patient.
Yeah. Yes.
All this can be done.
Yes.